Hello and welcome. My name is Dr. Aleena Banerji. I'm an associate professor at Harvard Medical School and clinical director of the Massachusetts General Hospital Allergy and Immunology Unit. We're going to talk today about hereditary angioedema, current and future treatment options. This second part is going to focus very much on the treatment advances in hereditary angioedema, highlighting the new data from the American College meeting in 2023. These are my disclosures. Our objectives for this session are specifically to review some of the newer data presented at the American College meeting in 2023, held in November in Anaheim, California. What we'll talk about in this section is to focus specifically on some of the newer advances in treatment options for patients with hereditary angioedema. We'll focus a lot on the newer data presented at the college meeting around investigational treatments that are in clinical trials at this time. The first therapy that I want to talk about is garadacimab. Garadacimab is a monoclonal antibody that inhibits activated factor 12. In this phase 3 study, patients received garadacimab 200 milligrams subcutaneously once monthly for up to 6 months, but this was after the 400 milligram initial loading dose. The primary endpoint or monthly number of attacks was assessed, as well as data looking at the percentage of attack-free patients at weekly and monthly intervals. What you see in the purple figure are significantly reduced number of attacks in patients receiving garadacimab compared to placebo, and also a very favorable tolerability and safety profile. The post-hoc analysis presented showed that garadacimab provides early onset and durable efficacy in the reduction and prevention of HAE attacks starting as early as week 1. Looking specifically at the data, what you see is a decrease in mean monthly attacks at week 1 down to 0.11 compared to 1.81 in the placebo arm. Looking at the attack-free rate, what you see is in the garadacimab group in weeks 1 through 4, a decrease or attack-free patients 92 to 97% compared to 50 to 66% in the placebo arm. These data are very promising for a new therapy for long-term prophylaxis in patients with hereditary angioedema. Next, we'll look at the open-label efficacy and safety data for garadacimab from ongoing phase 2 and phase 3 open-label extensions. The primary endpoint was treatment-emergent adverse events in patients with hereditary angioedema with C1 inhibitor deficiency. And as we would expect, the safety and efficacy was similar to what was seen in the phase 2 and phase 3 studies with garadacimab, again showing a favorable safety profile with similar durable efficacy with a decrease in monthly attack rate. In addition to the efficacy data, garadacimab in the open label extension studies had improvement in quality of life. They look specifically at the angioedema quality of life tool, as well as the subject global assessment of response to therapy. And what you can see is a clinically meaningful and long-term improvement in these quality of life measurements. This was very similar to what was seen in the phase 3 study. The next therapy that I want to review is donidalorsen. These are data presented at the college meeting from an open label extension study where they wanted to look at the safety, efficacy, and quality of life in the open label extension study. So this was in follow-up to the randomized phase 2 study in patients that was treated with donidalorsen, and that phase 2 study did show a mean 90% reduction in HAE attacks compared to patients in placebo. In the open label extension study that was presented at the college meeting, patients were either on a fixed dosing of 80 milligrams every 4 weeks, or flexible dosing of 80 milligrams every 4 weeks, 80 milligrams every 8 weeks, or 100 milligrams every 8 weeks. And in this open label extension study, 14 of the 17 patients completed 2 years of treatment, and data confirmed that donidalorsen was well tolerated and did have the efficacy that was seen in the phase 2 study. Again, showing sustained durability of efficacy, low treatment emergent adverse events, and confirmed the findings that were seen in the phase 2 study of donidalorsen. Looking again at additional data from the open label extension study for donidalorsen, what we saw is that there were no treatment emergent adverse events that were occurring drug-related in more than any one patient. There was a mean reduction in monthly attack rate of 83% from baseline. And this also was consistent, showing an improvement in quality of life compared to baseline in patients in the open label extension study. The next therapy that I wanted to review is deucrictibant. Deucrictibant is an immediate release capsule that is orally administered and is an antagonist of the bradykinin B2 receptor. These are data from the on-demand placebo-controlled phase 2 trial of deucrictibant. It was given at a dose of 10 milligrams, 20 milligrams, and 30 milligrams and compared to placebo. And what they found was a statistically significant improvement in the estimated median time to end of attack with all 3 doses compared to placebo, and that the majority of attacks treated achieved end of progression of treatment by 24 hours. Again, showing that there is promising therapy for an oral on-demand treatment for patients. Let's move on to look at some real-world data that was presented at the college meeting in patients with hereditary angioedema. Another important study that was presented at the college meeting helped us understand that patients with hereditary angioedema are not actually carrying their on-demand treatments, even though that is recommended across all guidelines. This specifically was a study conducted by the U.S. Hereditary Angioedema Association in patients with hereditary angioedema, and they were asked to complete a 20-minute self-reported online survey in the fall of 2022. And what they found is that almost half of patients are not carrying their on-demand treatment when they leave the house. The reasons for this were interesting, and it included in the majority of patients that they prefer to just leave it at home. In about half of patients, they reported that they forgot to take it with them. In another half of patients, they were afraid that if they took their on-demand medication with them, they would leave it somewhere and not have it back at home. And also, about 40% of patients reported that they didn't carry their on-demand medication with them because they were on long-term prophylaxis. I think this reminds us that patients should understand that attacks can occur spontaneously, and they can be laryngeal attacks, which can be life-threatening. And so it's really important for us as the physicians taking care of patients with hereditary angioedema to remind them that they should have their on-demand medication with them at all times, and at least 2 doses of on-demand therapy, which is what is consistent across all of the hereditary angioedema guidelines. In another very important study, they addressed the lack of data in underrepresented minorities in patients with hereditary angioedema. They surveyed in a non-interventional observational web-based format, specifically of racial and ethnic minority members of patients with hereditary angioedema. And what they found was that a lot of these patients had a very difficult journey, including a significant delay in their diagnosis of hereditary angioedema. They also avoided seeking medical care prior to their diagnosis of hereditary angioedema in almost all cases. And lastly, a significant number of misdiagnoses in these patients. What is reassuring, though, is that once they did have a specialist that understood hereditary angioedema, that they were satisfied with the care that they received for their hereditary angioedema. In this next study, looking specifically at patients with hereditary angioedema with normal labs, we understand that there is a significant unmet need in these patients. So this was conducted in 30 physicians across 15 countries, looking specifically at physicians who treat hereditary angioedema. Looking at treatment patterns, they found that more than half of patients were using on-demand treatment only. About a third of patients were using on-demand treatment as well as prophylaxis, and that icatibant was the most commonly prescribed treatment for patients with hereditary angioedema with normal labs, while tranexamic acid was the most commonly used long-term prophylaxis. But in terms of an unmet need, it was found that having a treatment that was specifically studied and approved for patients with hereditary angioedema with normal labs was an unmet need, as well as the availability of an oral treatment. Importantly, it was felt that the development of a reliable, validated, and easily accessible biomarker to accurately diagnose patients that have hereditary angioedema with normal labs was needed, and it was really needed not only to diagnose these patients, but also to improve the management and guide treatment options for these patients. In this next study, we're looking specifically at the burden of illness in adult patients with hereditary angioedema, and this was a non-interventional cross-sectional web-based survey of almost 300 adults across a variety of countries in South America and Europe. What we found was that the burden of disease continues to remain high in patients with hereditary angioedema, despite the availability of treatments. This included a report of approximately 11 attacks in the last 6 months, a third of patients reporting an attack in the last 7 days, and 7% reporting that the last attack affected their throat or larynx, which could be potentially life-threatening. So more than half of these patients were on long-term prophylaxis, but they continued to have a high frequency of attacks that was impacting their quality of life. So still showing that we have a lot of work to do in improving the care of patients with hereditary angioedema to address this high burden of illness that they're facing. The next two studies that I'll review look at the burden of illness of caregivers. In this study, 55 patients were surveyed who were caregivers to pediatric patients with hereditary angioedema. The mean age of the pediatric patients was approximately 4 years at onset and around 10 years of age at the time the survey was completed. And what the survey identified was that these pediatric patients had a mean number of attacks of 6 in the last 6 months. So about once a month they were having attacks. Almost half of them reported an attack in the last 4 weeks. 14% reported that the last attack impacted the larynx, again, potentially life-threatening. That there was an impact on school and work for not only the pediatric patients, but also the caregivers. And that there was a significant impact on sleeping, causing anxiety, including impacting relationships with family and friends. And so there is a lot of work that we have to think about for the caregivers of patients, of pediatric patients with hereditary angioedema. And in follow-up to that is data looking at the burden for caregivers of adult patients with hereditary angioedema, again showing that there's a significant number of HAE attacks, that there is a significant amount of anxiety, sleeping problems, missed day of work, that these patients, caregivers, do also need our support, our help, discussion with how best to support the caregivers, not only of the pediatric patients, but also of the adult patients. And it's an important aspect that's often forgotten about, but these data clearly show that there's something that providers and physicians taking care of patients with hereditary angioedema need to think about. So to summarize, I think we've shown some very interesting data for investigational therapies for patients with hereditary angioedema, including garadacimab, donidalorsen, and deucrictibant, showing promising efficacy with good safety profiles. We also showed that many patients are not carrying their on-demand therapy and that there is work left to do for those of us that take care of patients with hereditary angioedema. We also have work to do in the racial and ethnic minority groups where the difficulty in obtaining a diagnosis is still significant. But once the diagnosis is made, that these individuals are satisfied with the care that they're receiving, and that there's still a high burden of disease for patients and caregivers and patients with hereditary angioedema with normal labs. And so some work for those of us in the field to think about as we're taking care of patients and thinking about research paths. Thank you for your attention.